Flu and cold season is here. You probably don't need me to tell you about that. Vermont health experts say the spike is part of a national surge that's expected to continue over the next several weeks. ABC 22's Jordan Barber reports now from the newsroom.
Cold and flu season is striking the state with sniffles again this winter. With more people moving indoors and kids coming back from school breaks, state experts say respiratory viruses like COVID, seasonal flu, RSV, and pneumonia are on the rise.
And these viruses love to find homes in human beings, and they come in all different flavors.
Earlier this month, the state saw an increase in COVID-19, influenza, and norovirus outbreaks, one of which caused Cabot School and Twinfield Union to close this past Tuesday due to large swaths of students and teachers getting sick. John Davey, an epidemiologist with the Vermont Department of Health, tells me the state has recorded 27 norovirus cases this year, but they are mostly being reported in schools and long-term care facilities.
Schools present a real interesting challenge for public health and for school nurses. School nurses have a lot of responsibilities to try to keep illnesses outside their building, but of course at this time of year, sniffles are very common, continued symptoms are very common.
While Davey tells me illness can be expected at this time of year, schools can take steps to improve their ventilation systems, which may help stop the spread. In good news, though, he tells me RSV, which can become deadly for infants and older adults, is past its peak, with the number of cases stabilizing. Pediatrician James Saperstone says in the Northeast, the flu has posed a challenge.
As we're recovering and walking away from COVID, the flu season is now back. There's, it's spreading like wildfire.
He tells me the rise in respiratory illnesses may be due to people going back to large gatherings and taking less precautions with masking. The doctor also says with more people becoming cautious of vaccines, there is a higher chance of illness spreading. Davey says the state will continue monitoring statewide data and working behind the scenes with Vermont schools and healthcare workers. He recommends taking vaccines and precautions such as wearing a mask, washing your hands, and staying home if you get sick. Reporting from the newsroom, Jordan Barber, ABC 22 News.